Louise Thompson, the former star of the reality television series Made in Chelsea, faced an unexpected challenge this holiday season when she had to spend Christmas Eve undergoing a medical procedure in hospital. The 35-year-old mother and fitness enthusiast has been remarkably open about her long-term health struggles following a traumatic childbirth experience, and she used the occasion to once again highlight the vital role of the UK's National Health Service, NHS, during times of need. On the day before Christmas, Louise shared updates with her followers, explaining that she had undergone a proctoscopy, a diagnostic procedure similar to but less invasive than a colonoscopy. Given her medical history, which includes the fitting of a stoma bag after serious complications, the procedure was adapted to her specific anatomy. Louise described it as bloody, awkward and a tiny bit uncomfortable, but noted that the medication provided, including fentanyl, made it manageable. She posted images from the hospital, including one in a gown and another with a nasal cannula for oxygen support, to illustrate her experience without dramatizing it. Louise emphasized that while the timing on Christmas Eve was not ideal, the urgency of the appointment made it necessary, and she was grateful for the opportunity to have it addressed promptly. She reflected on the significance of the date, acknowledging how it coincided with a major holiday, but praised the dedication of healthcare workers who continued operations despite the festive period. Her messages conveyed deep appreciation for the NHS, describing it as an institution that never clocks off and never sleeps, always ready for emergencies no matter the day. This hospital visit is just the latest chapter in Louise's protracted battle with health issues that began with the birth of her son, Leo Hunter, in 2021. During an emergency cesarean section, Louise suffered severe hemorrhaging, losing an estimated 12.5 liters of blood, an amount that brought her perilously close to death. The ordeal left lasting physical and psychological scars, leading to diagnoses of post-traumatic stress disorder, PTSD, postnatal anxiety, lupus, Asherman syndrome, and further complications including a second hemorrhage. In the aftermath, Louise required extensive medical interventions, including the permanent fitting of a stoma bag to manage bowel function after significant damage. Her recovery has been non-linear, involving multiple hospital stays, therapies, and adjustments to a new normal. Mentally, the trauma was profound. She has spoken about periods of being mentally checked out, to the extent that professional crisis support was involved, including measures to prevent self-harm. Her fiancé, Ryan Libby, has provided insight into the darkest moments through public discussions. He recounted how a crisis management team visited regularly, essentially placing Louise on suicide watch due to her detachment and despair. Ryan described the terror of witnessing his partner in such a state, exhausted, transformed physically, and struggling to connect with their newborn son. He admitted to not fully comprehending the depth of her pain at the time, reframing it as shock and surrender rather than immediately recognizing the suicidal ideation risks. Ryan also revealed his own hidden struggles, developing resentment unintentionally toward Louise as she couldn't fulfill the maternal role he had envisioned. Months into the postpartum period, family members noticed Ryan's declining mental health, leading to his recognition of depression. This mutual strain tested their relationship but ultimately highlighted the often overlooked impact on partners in such crises. Louise's candor about these experiences has resonated with many, turning her into an advocate for maternal health awareness. She frequently shares updates on social media, balancing vulnerability with empowerment, often incorporating humor, like referring to her procedure as a nice little Christmas Eve camera up my bum. This approach demystifies serious health topics and encourages others facing similar issues to seek help. The NHS features prominently in Louise's narrative as a lifeline. Despite the chaos of her multiple conditions and treatments, she repeatedly expresses gratitude for accessible, round-the-clock care. Her Christmas Eve story underscored this, noting how services remained operational, albeit adjusted, during the holidays. Many patients and supporters echoed her thanks, recognizing the sacrifices of staff working through family time. Louise's journey post-birth has involved rebuilding physically through adapted fitness routines. She was once known for her wellness brand, and emotionally through therapy and family support. Leo Hunter, now a toddler, brings joy amid challenges, and Louise often shares heartwarming moments of motherhood, contrasting with the hardships. Complications like lupus, an autoimmune disease, add unpredictability, requiring ongoing monitoring. Asherman syndrome, involving uterine scarring, compounded fertility and recovery issues. The stoma bag represents a major life change, one Louise has discussed openly to reduce stigma around ostomy living. Ryan's perspective adds depth, illustrating the ripple effects on families. His podcast revelations about reframing Louise's state, from exhaustion to potential life-ending thoughts, humanized the experience. He spoke of her vacant stares lasting days, loss of fight and disconnection from the baby, painting a vivid picture of postpartum mental health crises. Their story sheds light on under-discussed aspects of childbirth trauma, including near-death experiences leading to PTSD. Louise's survival and advocacy inspire, showing resilience in sharing dramatic, yet necessary procedures publicly. As she recovered from the Christmas Eve appointment, Louise likely returned to celebrations with Ryan and Leo, cherishing quieter moments. Her updates foster community with followers offering support and sharing stories. Broader implications include calls for improved maternal care, recognizing signs of PTSD, and supporting partners. Louise's platform amplifies these voices. In reflecting on her health battle, Louise embodies strength, turning adversity into awareness. Her NHS praise reminds of public healthcare's value, especially in crises. The procedure, while minor compared to past events, reinforces vigilance needed in chronic conditions. Fentanyl's role in pain management highlights medical advancements aiding comfort. Louise's humor lightens heavy topics, making discussions accessible. Her nasal cannula photo showed vulnerability without self-pity. Family support remains crucial. Ryan's involvement in care and advocacy strengthens their bond. Looking forward, Louise continues inspiring through fitness, writing, and openness. Her story evolves, emphasizing hope and healing.